Now, the government's official figures show that more than 50,000 people have died with COVID-19 in the UK. But on another measure called excess deaths, the figure is almost 71,000. Excess deaths is the difference between deaths this year and the average number over the past 5 years. The latest figures also underline the differences across the UK during this second wave, with the northwest of England recording over a third more deaths than usual, while London has seen no difference at all. Our health editor Hugh Pym has been studying the figures.
A community hospital facing up to COVID. The coronavirus ward at Clacton Hospital in Essex is getting busier, more so than in the first wave.
Hello, Sheila. We keep doing your swabs.
Some patients are here for 2 weeks or more, waiting till they test negative, but some have not survived.
The staff at the moment are quite emotional. We've had quite a few deaths, and it's quite hard managing staff that are emotional. They need, like emotional support.
The overall COVID impact is shown in total excess deaths from all causes. That's the number above what's expected at this time of year, with the latest figures for the first week in November. This line shows the average number of UK weekly deaths over the last 5 years, and this one shows what's happened so far this year. And you can see there was a sharp spike at the peak of the first wave in April. The red area shows COVID deaths, the blue other excess deaths, some of which may be linked indirectly to the virus because people didn't seek or didn't get hospital treatment. Then it falls back towards the average before picking up again in recent weeks, though it's still well short of that first peak. There's a lag between cases being diagnosed and then some patients getting seriously ill and not surviving.
We can expect deaths to carry on going up for several more weeks because we already know that cases have been going up for several weeks, and the people whose deaths were registered in the latest data will probably have caught COVID sometime in October.
There were big variations in excess deaths. The highest in the northwest of England, Wales and Northern Ireland were all around a third above their 5-year averages in the latest week. Scotland's were 12% above average. The lowest included the east of England with 6% and London with no deaths above the average. Experts say in some parts of the country, infection rates didn't come down as rapidly as others when lockdown restrictions were eased in the summer.
In areas like the northwest, it still remained much, much higher than areas like London and the southeast. So what that meant was when we came into autumn and schools went back, infections started to increase from a much higher level. And so we're seeing those higher levels in these areas feed through to much higher mortality and excess death rates.
Ministers and officials say case numbers should start falling soon, and that should pave the way for a return in December to tiered restrictions in England. But what that means for Christmas is anyone's guess. Hugh Pym, BBC News.